If you think food at the grocery store is expensive, then you haven't been paying attention to medical care. Hospital services have skyrocketed over 200% in 2 decades, and there's no sign of slowing down. In retirement, inflation combined with simply needing more medical care as you get older can present a big problem for your money if you're not prepared. So today I'm going to reveal the average cost of healthcare you may experience in retirement as estimated by Fidelity, how that compares to what retirees expect to pay for healthcare, and I'll give you 5 simple solutions I use with my clients so healthcare doesn't break your retirement nest egg. I am Anthony, CEO and certified financial planner at One Degree Advisors, and along with my partner Alex, we make videos to help you retire confidently. Healthcare is one of the big 3 retirement expenses along with housing and taxes. Most Americans use Medicare once they hit age 65, where you can expect to pay premiums and out-of-pocket expenses like copays and deductibles when you go to the doctor. But your healthcare costs don't stop there. You may also have dental and vision costs, which are not typically covered by Medicare. Also, long-term care, or sometimes called custodial care, can potentially be the biggest health expense of all, and that's not covered by Medicare either. I'll further explain how long-term care works as well. So how much does the typical retiree spend on healthcare? Fidelity has revealed through its retiree healthcare cost estimate that the average retiree currently at age 65 will spend $157,500 on healthcare in retirement. That's $315,000 for a couple. These costs have exploded. The cost estimate back in 2002 was $80,000, so costs have nearly doubled in 20 plus years, and that was when overall inflation was pretty low. Now, this does require some explanation as to what Fidelity does not include in their estimate and how people are far underestimating what they will spend on healthcare. Let's start with the latter, because in the study, Fidelity references that the average American couple expects to spend only $41,000 on healthcare in retirement. This is a major underestimation compared to the $315,000 the average couple will spend. I'm actually not surprised by this because I do find that most people severely underestimate their general expenses when asked, and that's a problem that's broader than just healthcare. If you don't get that target retirement expense right, or at least close, you might find yourself struggling down the road. I've mentioned in previous videos how we use a system to more accurately target a retiree's costs into the future. It's based on replicating someone's true standard of living and projecting that into retirement. And because healthcare costs generally increase as you get older, there should be specific planning for this increase in costs, or at least a cash cushion that can help pay for these healthcare costs. Now, as to what is missing from the Fidelity estimate, it says, this calculation takes into account Medicare Part B base premiums and cost sharing provisions such as deductibles and coinsurance. It also considers Medicare Part D, that's that prescription drug coverage premiums, and other out-of-pocket costs. And it goes on to say, this estimate does not include other health-related expenses such as over-the-counter medications or most dental expenses and long-term care. So remember, when dealing with averages, the range of outcomes can vary quite a bit. And in this case, that $157,500 is excluding potentially major expenses like dental and long-term care. Medicare.gov and plenty of other resources online can help you determine what's covered by Medicare, but basically Medicare is meant to be your regular health insurance to help cover hospital care and doctor's visits. I'm going to address 2 solutions regarding Medicare in just a minute so you don't waste your money and you can get the proper care. Long-term care, however, is not quite like your typical Medicare when you go to the doctor or the hospital, and that's why it's not covered by Medicare. Long-term care is based on needing assistance or supervision with daily living activities like getting dressed, bathing, or getting around your home. Cognitive issues like dementia can also fall under this category, and care can be provided in your home or in a facility. There is specific insurance for long-term care, but it's not cheap and not subsidized by the government unless you are reduced to poverty status, and then Medicaid kicks in, or it's called Medi-Cal here in California where I am. Clever name, right? But the quality of care is not to many people's preferences, so I suggest you don't rely on that if you can avoid it. I highly recommend taking a look at Genworth's Cost of Care survey. They update it each year. I'll leave a link in the description as it breaks down the average cost by state for different levels of care. Now, I know these costs can seem overwhelming, but I'm going to give you 5 simple solutions so these costs don't destroy your retirement nest egg. Let's jump into that. And by the way, please subscribe if you want to join us on your retirement journey. We make videos to help you have confidence so you can make the absolute best decisions possible. Okay, solution number 1, use a Medicare specialist to find the best plan for you that's cost effective and includes the doctors you want to see. Like many of you know, Medicare is not quite one size fits all. There are what's called Medigap policies, which are supplements to the very basic Medicare coverage. When my clients are close to turning 65, I refer them to a Medicare specialist. This is a professional who knows the ins and the outs of the plans. My clients will go to a professional I trust and tell them, here are the doctors I want to see and here's my budget. My clients don't want to be Medicare experts. At most, they've helped their parents at one point, but they want to find the right plan and not overpay. So get guidance from a Medicare specialist. They're typically paid by the Medicare plans if you sign up for a plan through them. So there shouldn't be an out-of-pocket cost. Just make sure to ask. Okay, number 2, health savings accounts or HSAs. These offer the triple tax benefit. With the saving tool, you can get a tax deduction for money contributed. That money can then be invested within the account and grow tax deferred, meaning you're not paying taxes on interest, dividends, and capital gains. And then thirdly, when that money comes out to pay for qualified medical expenses, it's completely tax-free. Now, once you enroll in Medicare, you can no longer contribute to an HSA, but you are allowed to use the money for medical expenses once on Medicare. So if you're pre-Medicare now, think about saving as much as you can into an HSA because you can let it grow, get the tax benefits, and then use it during retirement when healthcare expenses may be higher for you. If you don't know how an HSA works, I'll drop a link in the description to learn more. Make sure to review the eligibility requirements. I mean, the bottom line is an HSA is a way to make your money work for you via investments and tax savings so you can save money on medical costs later in life. Number 3, Medicare IRMA brackets are like tax brackets, but they actually determine how much you pay for Medicare Part B premiums. That's right, your income determines if you pay a higher premium. And as you'll see in this chart, it's always 2 years behind. So 2024 premiums are based on 2022 income. And 2 things I really want to point out here. One is that you can appeal to Medicare for several reasons, but one common appeal is for reduction of income, which could apply when you retire. Let's look at an example. In 2022, Susie's working and she earns $125,000. This would put her in the second premium bracket, which causes her to pay an extra $70 each month. But in 2024, when she gets that notice about the higher premium, she's now retired and her income is $100,000, which is in the first bracket at that base premium. Well, she can file Form SSA-44. I'll leave a link in the description to request that Medicare reduce her premium. The second thing I want to point out is this variability of Medicare premiums is another reason that proactive tax planning is so important in retirement. If you're $1 into that next bracket, you pay the higher premium. Now, this is not about suppressing your income in retirement. We want that to be high, but rather not paying more in tax than you need to, which is effectively what this premium increase is. This is another reason why we're often showing how to effectively tax plan in these videos. Number 4 is your health and wealth. Taking care of your physical health can save you money, and wisely managing your money can help you support a healthy lifestyle. They're mutually beneficial. The New York Times reported on a research study linking exercise to saving money in retirement. It says, becoming more physically active today might help us avoid thousands of dollars in healthcare costs later. According to a new study of exercise and Medicare claims, it finds that people who start exercise before or during middle age typically save anywhere between $824 to $1,874 annually on healthcare costs after retirement. And the earlier they start their workouts, the greater the savings can be. And vice versa, good money management can lead to better health. Things that are often noted by doctors and other research studies is that good money management, number 1, it relieves stress. 2, improves social connectedness, thus reducing loneliness, anxiety, and depression. And 3, it allows you to get the proper healthcare you need, including preventative care. I want you not just to get by. I want you to have a healthy, quality life so you can be there for those you love. So get your body moving, get regular checkups with both your doctor and your financial planner. Finally, number 5, have a plan for potentially the largest of all healthcare costs, long-term care. The stats show that a 65-year-old has a 70% chance of needing some type of long-term care in their lifetime. Remember, Medicare does not cover extended long-term care. There is insurance specifically for long-term care. It's expensive because of the high probability and high cost of use. You need good health to qualify, and premiums increase substantially with age. So it's optimal if you are exploring insurance coverage, do so in your 50s or your early 60s before you really need it. The alternative insurance is self-insuring. That's being ready to pick up a significant tab. This cost can be magnified with a married couple if, say, one spouse has significant care costs and the other is living on their normal household budget. However you choose to address it, just don't ignore it. Do your research and determine what works best for you. Start by watching this video, Is Long-Term Care Insurance Worth the Cost? We'll go ahead and see you over on that video now.